In this video, we're going to be talking about why you get bags under your eyes or have puffiness that builds under your eyelids. So let's identify some of the causes. Some of the causes include allergies, can include a high salty diet, can include tears running down your cheeks. Because what happens of why puffiness builds, we'll get to the allergies in just a moment, but the puffiness from a high salty diet as well as tears, salt is actually contained in your tear film. And what occurs is when the tears run down your cheeks, you're crying, you're emotional, had a hard day, something very traumatic happened, things like that. As the tears run down your cheeks, they contain salt. The tears run down right about here. And what happens is that the tears and the salt get absorbed into your skin. And as it gets absorbed into your skin, it can actually retain more water because salt will pull water from other external skin surfaces or areas around the cheek muscles and retain that water to cause puffiness and droopy eyelids and kind of darkish colored grayish purplish eyelids. Now, going back to the allergies, what can cause that is an overreaction, whether it's an anaphylactic reaction or a contact dermatitis related reaction, can cause some of the tissue in the skin to swell up with too much histamine. And with too much histamine, that causes too much skin water retention and causes the puffiness under the eyelids and can lead to bags afterwards or like kind of droopy eyelids right here. So those are a couple of the main causes for what causes bags under the eyes. Lack of sleep can also do this. Unhealthy lifestyle and diet can also do this. But what can we really do about bags under the eyelids? Well, there's a couple of things I'm going to suggest and recommend that what we talk to about patients a lot of times of how to get rid of the bags under the eyes. One of the first things you can do is to apply cold compresses or ice, or get like an ice pack or a frozen bag of peas or things like that. I've got a washcloth right here. It's not cold, but this is just to demonstrate. Basically, you get it very cold. You can put it in the freezer. Then you would just kind of put it under your eyelids like this. Make sure it hits that baggy portion right underneath the eyelids. And what the cold will do is the cold will actually cause skin and muscular tone, as well as blood vessels, as well as fluid, to constrict and contract and be removed and dispersed to other places. So the cold will actually get rid of a lot of things when it comes to baggy or droopy eyelids or even puffy eyelids for that matter. Some of you may have even heard the spoon trick, which you can even put a spoon in the freezer, put it right underneath the eyelids, just kind of like this. And with the cold spoon to that skin surface, it will do the same thing as the cold washcloth to really get rid of that puffiness and droopiness and swelling of fluid there. And some of you may even use some of the creams that are over the counter, retinol, skin cream. Their results are a little inconsistent and hit and miss as far as what works and what doesn't, because some of them do work and some of them don't work. So if you found something that works, that's healthy, doesn't cause you any skin reaction, fantastic. Now, if your eyelids are really droopy, like let's say they're really pooched out down like that, sometimes you may need some surgery in order to get the lid muscular tone back, to get those lids functioning the way that they need to. This would be done by a consultation with your surgeon. A lot of times different surgeons can do this. This could be an oculoplastics, ophthalmologist, or even plastic surgeon, just to name a few. But that would be a conversation between you and your surgeon to kind of look at that a little bit more. And that's more of a dramatic red, irritated lid appearance for the most part. But that's how we get rid of bags under the eyes. It's pretty quick, pretty easy, and pretty straightforward to take care of. If you like this video, give it a thumbs up, subscribe to the channel, and tap the bell for notifications to learn more about your eyes. I'm Dr. Bryce Heffington, and we'll see you next time.